Mr. Speaker, Mr. Chairman, it has been over a year since the pandemic started. As of today, over 114 million individuals all over the world have been infected, and more than 2 million people have died. We've been fortunate with the whole of government effort and everyone's support, patience, and cooperation. After successfully bringing the COVID-19 outbreak in our migrant worker dormitories under control, we continue to maintain tight measures to minimize transmission, and these include safe management measures, rostered routine testing every 14 days, as well as the distribution of contact tracing devices to our migrant workers. In 2020, the construction, marine and process workforce, or CMP, has shrunk considerably by about 15%. The CMP workforce are the main occupants of our dormitories. With fewer workers and with more safe management measures, there have been significant project delays which have impacted completion timelines for ongoing construction projects. This cannot continue indefinitely. We are now able to progressively bring in new migrant workers to support our businesses. However, let's not be mistaken. This by no means represents that we have won the battle. In fact, as I've alluded to in my previous speeches before, at the end of last year, we have just reached base camp. This base camp is different in that, unlike Mount Everest or any mountain peak where we know where the full height of that peak is, for this particular crisis, we really do not know where that peak is. Early this year, as the global COVID-19 situation worsened, we tightened measures to contain the risk of spread from imported infections. We introduced on-arrival tests and an additional post-stay-home notice 7-day testing for CMP workers. And this essentially means that the stay-home notice, the SHN for these workers, have been extended to 21 days. This further mitigates and minimizes any risk of an imported case from transmitting the virus into the dormitories or into the work sites. But our work is far from done. Continuous adaptation, continuous improvement have helped us to bring the pandemic under the current state of control. But even as we continue to battle the evolving global and local situations, we continue to take on board the valuable lessons that we've learned from the past many months of managing this current pandemic. To prepare for future pandemics, we will transform our migrant worker landscape in 3 key areas. First, we will fortify the upstream entry controls and measures for migrant workers. This is done so that we can minimize the transmission risks of new workers arriving on our shores and to ensure that they are properly onboarded before they move out into our community. Second, we will strengthen the resilience of our dormitories. This includes conducting a comprehensive review of the housing standards of our dormitories, strengthening regulatory controls to enable us to continuously raise housing standards across the various dormitory types and sizes. Third, we will also ensure the sustainability of all of our efforts to assure, to care for, and to engage with our migrant workers. We will do so through cost-effective healthcare, establishing a migrant worker volunteer network to deepen our engagement with them, as well as partnering with our NGOs, employers, and community organizations. On the first initiative, that of fortifying migrant workers' entry and onboarding processes, renewed inflows of migrant workers will be needed to continue to meet the needs of our growing economy. But at the same time, we have to ensure that good public health outcomes are achieved. To do so, we have set up a migrant worker onboarding center. This is a one-stop center to pilot an end-to-end onboarding process for all CMP, sector work permit, and S-Pass holders entering into Singapore. Now, there are 3 elements to this. First, the stay-home notice period. Second, an enhanced medical examination program, and thirdly, an orientation and settling in program for these migrant workers. The journey for a migrant worker to safely enter Singapore can be segmented into 3 zones. First, the green zone. This refers to the upstream precautionary efforts in the source countries. Today, before migrant workers depart for Singapore, they are required to take a COVID-19 PCR test in their home country and produce a negative PCR test result within 72 hours before their departure. Robust pre-departure tests will minimize and mitigate imported cases and allow more workers to come in. Now, there are some employers already taking extra precautions in verifying the health status of their workers by even employing the use of serology tests before departure. This is over and above the PCR test. This allows our employers to identify workers who have recovered from COVID-19 so that the public health measures that we are going to adopt on arrival can be more targeted. Second, the blue zone, and this refers to what we do here in Singapore. So when they arrive here, we have introduced a combination of on-arrival PCR tests as well as serology tests. This allows us to better differentiate between recent infections from older infections, where the recovered persons can still be intermittently shedding the virus, but they're no longer contagious. For example, these workers who are found to be already recovered, we can exempt them from SHN. All other CMP workers from higher risk countries are now required to serve 21 days, first 14 days of SHN plus another additional 7-day testing process as a further precaution. And this is where our one-stop MWOC comes in. So at the MWOC, while the workers are undergoing the additional 7-day testing process, they will also go through a residential onboarding program comprising of 1, the enhanced medical screening program, and 2, that orientation and settling in program that I've alluded to earlier. This enhanced medical examination program will entail a more comprehensive and rigorous screening to enable appropriate health support and interventions. For example, workers above the age of 40 or with risk factors will also be screened for chronic illnesses like diabetes, high blood pressure, and high cholesterol. This enables us to identify these risks earlier and have a more effective, targeted downstream patient care. It also reduces potential work disruptions and unexpected medical costs for employers from untreated health conditions. The residential settling in program will also inculcate better dormitory living and worksite practices amongst migrant workers who have just arrived here to help them understand their employment rights, the kind of good health practices, and Singapore's social norms. And for instance, workers will learn to adopt the safe management measures, to learn how to use contact tracing devices, safe entry check-ins, as well as the foreign worker mom care app to monitor their own temperatures, update daily health status, and access telemedicine if symptoms are reported. And our guest migrant workers will learn when and how to seek help when they are unwell or when they need assistance with employment disputes. Third, the white zone. This refers to the time when the workers have cleared all these checkups and when they can move into their respective residential dormitories and adopt safe living measures, both at work as well as in the community. So this MWOC brings together various entry processes as one efficient, seamless, integrated end-to-end process. Centralizing, coordinating the operations and functions together also facilitates faster reaction times, as well as it allows us to adapt and be able to preempt better preparation for future pandemics. It benefits employers, workers, and the general community in Singapore. For employers, bringing the processes together helps to lower the risk of transmission from imported cases, enabling the entry of more migrant workers to support our businesses where they are needed. Employers, especially the small medium enterprises, will have the benefit of the MWOC providing an end-to-end SHN and onboarding service, compared to now, where each employer would have to arrange for the medical screening and the SIP on their own after the workers have completed their SHN. For workers, the onboarding program will help them start their employment in Singapore on the right footing, with them knowing their rights. The MWOC will also provide the flexibility to adjust the SHN as well as testing measures in the blue zone, depending on the volatility and the fluctuations of the situation in the source country from where they come from in the green zone, so we can calibrate it appropriately. This is done in order to safeguard the safety and the health of the workers, as well as our general community in the white zone. Ms. Sylvia Lim highlighted her concerns of households and businesses of the uncertainty when bringing in migrant workers. This MWOC is part of our efforts to minimize COVID-19 importation risks, and we hope that this will also serve to minimize other types of future infectious disease importation risks, so that we can bring in sufficient numbers of workers to support the needs of our economy. We adjust the entry numbers in a very dynamic fashion, depending on the infection transmission risk in each one of the home countries, depending on the risk levels, depending on the regions that our workers come from. And we facilitate the entry of foreign workers that's required for key infrastructural projects. We've also been responsive, and we've provided a higher degree of certainty to employers as well as households. Entry approvals are allocated on a first-come, first-served basis by the chosen arrival date, when we facilitate where it is needed, even families to come and enter together. Entry applications will get an outcome by the next working day. Employers will also be advised on the next available arrival window should applications for their chosen arrival dates be unsuccessful. Mr. Desmond Chu, Mr. Muhammad Fahmi, Ms. Rachel Ong, and Mr. Louis Ng asked how we can and we will improve on the standards of dormitories, including smaller sites as well as factory-converted dormitories. Today, we have a variety of migrant worker dormitories, the purpose-built dorms, PBDs, the factory-converted dormitories, FCDs, the construction temporary quarters, the CTQs, and the temporary occupation license quarters, or TOLQs. 60% of the 280,000 migrant workers in dormitories stay in just 50 large dormitories with beds of 1,000 or more. And they are regulated under the FIDA Act. FIDA stands for Foreign Employees Dormitories Act. 40% of them are in the numerous FCDs, CTQs, and TOLQs. All dormitories, whether regulated under FIDA or not, are subjected to a set of regulatory requirements set by the various government agencies, covering areas such as building and fire safety, minimum living and hygiene standards, and FIDA imposes additional requirements in areas such as public health and safety, security and public order, and the provision of social and commercial facilities as well as services. Our experience in containing this pandemic in the dorms highlighted the need to strengthen our regulatory levers in order to enable us to raise and enforce housing standards very quickly across the various dormitory types and sizes, and to introduce new housing standards to make dormitory living more resilient to public health risks. We are thus reviewing the scope of FIDA to expand it to cover all dormitories, regardless of size. This will allow us to bring the regulation of all dormitories, that means it covers the FCDs, the CTQs, and the TOLQs, under one single act. And we are going to introduce a consistency in terms of housing standards and safe living requirements in all the dormitories through this FIDA Act expansion. This will allow Ministry of Manpower to prevent and more quickly contain disease outbreaks in the dorms. Requirements to create more isolation bed facilities, stringent infection control measures, and ensuring dormitory residents' well-being had to be implemented on non-FIDA dormitories today through the temporary COVID-19 control order. So when we expand the scope of FIDA, this would empower mom to direct and quickly impose safe living and infection control requirements. This also enables MOM to implement that consistency of framework of housing standards across the dormitories of the different sizes and types. So we will have common requirements such as across the board, such as cleanliness, space and ventilation, as well as additional requirements that depend on the size, such as recreational facilities in some of the larger dorms. We will engage stakeholders in the coming months to review, to get their input in terms of expansion of the scope of feeder, and we will consider the details of the regulatory framework by incorporating their feedback. And we hope to complete this review and provide more details in the second half of 2021. Ms. Cheng Li Hui and Ms. Hazel Phua asked whether dormitory standards will be adjusted and how the higher costs arising from future improved dorm standards will be managed. As most migrant workers continue to live in communal settings, it is critical to improve and better prepare and future-proof our dormitories for future pandemics. Since September 2020, we have progressively rolled out over 25,000 beds in quick-built dormitories, QBDs, and to respond to the immediate COVID-19 challenges while strengthening the public health resilience of our dormitory against infectious disease outbreaks and enhancing living conditions for migrant workers, we have piloted a set of improved standards at these QBDs to test for the effectiveness, the feasibility, and the economic viability and sustainability. For example, the capacity in each QBD room is capped at 10 residents. This is in order for us to reduce intermixing amongst residents. And each QBD room is also fitted with ensuite toilets to minimize transmission risks from shared facilities. Kitchens, dining rooms, and laundry areas also cater to smaller groups of residents. The principal basis is to dedensify all the rooms, to facilitate the segregation of residents so that during a pandemic we can quickly impose lockdowns in a very targeted and precise manner. We are also conducting a holistic review on these improved standards to be applied for future new dormitories, keeping in mind that every new disease outbreak can be very different from the existing one. So we are always working in close consultation with MOH, with public health experts, and the various stakeholders, such as employers, migrant workers themselves, dorm operators, and NGOs to gather all of their views in coming down and coming up with the new standards. We will also draw on our experiences from the quick-built dorms. In addition to infrastructure, we are also studying how contact tracing has enabled us to more accurately identify and isolate and quarantine close contacts in the event of a public health outbreak. There are also innovative processes and practices in dorm management that can be adopted to improve overall standards in terms of infection prevention and control. We expect to finalize all of these standards later this year. We recognize that higher standards may also result in higher costs for employers and dorm operators. And many businesses would have locked in their costs in their existing projects and will now need time to adjust to higher migrant worker housing costs. Dorm operators may also be more cautious in building to build and own new dormitories, given the current uncertain demand for the migrant worker housing, alongside with the evolving situation. The government is studying the possibility of developing the upcoming PBDs on a different operating model compared to the current system, where land is released for commercial operators to bid, to build, and to operate. We are studying each option very comprehensively, and we will share our findings. And again, we will work with industry to get their feedback in due course. For the existing dorms, we will consider how to progressively improve standards, pacing it and phasing it so that price fluctuations will not be steep and the gradient will be gradual, while ensuring competitive bed rental prices, ensuring a continual stable housing supply during the transition period. And we will update all this in due time. Having put in place all of the upstream and long-term measures as explained earlier, we need to ensure that all of our efforts can be sustained for the longer term. Disease outbreaks will harm not just our valued workers, but disease outbreaks also have grave implications for employers, for the economy, for our resident population as a whole, and the provision of many services. Hence, it is in all of our interest to make sure that we continually take good care of our migrant workers. COVID-19 has provided the impetus for us to relook at how we engage, how we support our migrant workers. We have to establish, and we will establish, a resilient, a safe support ecosystem to care for them. Ms. Hazel Phua asked whether MOM has sufficient manpower to implement all of these ambitious plans. Since August 2020, we've set up the ACE group. ACE is an acronym for Assurance, Care and Engagement. Our ACE officers regularly check on dormitories. We have also got a FAST team on site to work with the migrant workers. This assures them, we assure them of our continued interest in preserving their well-being. And we continue to provide holistic physical, mental, and social care for them. Our multi-layered strategy of regular testing and swift containment has also effectively helped to contain infections in the dormitories to the currently very low levels. This outbreak has highlighted gaps in the primary healthcare that migrant workers have received pre-COVID-19. Often, migrant workers might delay or avoid seeking medical attention until the condition worsens significantly, with negative consequences for health, employment, and work outcomes, both for the worker as well as their employers. The government has since made it easier for migrant workers to access good primary health care. We will need to be able to sustain this for us to constantly survey and have sentinel reporting clinics to detect public health threats early. So today, about 200 workers use the 24-hour telemedicine service available to them via the FW Mom Care on a daily basis. We have piloted 13 regional medical centers, and we further increased the access by opening a night clinic in each of the West, Central, and the East regions of Singapore. About 500 workers a day receive medical support for non-ARI, non-acute respiratory illness, conditions like gastritis or chronic diseases like diabetes. Beyond this pandemic period, we will take stock of the healthcare ecosystem for migrant workers residing in our dormitories and other housing types to see how we can sustain the longer-term access to primary healthcare in a cost-effective and culturally sensitive way. For example, we hope that every migrant worker can be registered with a designated medical center or GP clinic near where they live and work to foster better continuum of care and better doctor-patient relationships. In this way, we will shift beyond the episodic care to better manage chronic health conditions, including mental health. We've set up a Project Dawn task force, and we've also introduced a 7-point mental health strategy comprising mental wellness, identification of at-risk patients and factors, screening of mental health conditions, surveillance of mental emotional distress, development of and training of para-counselors and counselors, timely escalation of care, and the provision of post-intervention care to complete and ensure a holistic mental health support ecosystem for our migrant workers. Our employers remain responsible, ultimately, for providing and paying for their workers' medical treatment. Hence, our review of the primary healthcare support will also aim to keep these costs manageable. In a small minority of hospitalization cases, employers can face large medical expenses. MOM is reviewing the medical insurance coverage for migrant workers to help employers better manage the medical expenses and to give both employers as well as the workers greater peace of mind. Again, we will provide an update later this year. COVID-19 vaccinations will also be made available to migrant workers. When ready, this will be accompanied, and it will be ready soon. It will be accompanied by comprehensive communications in all of their native languages. This additional layer of protection strengthens our defenses. When we encourage when the time comes, all of our employers and workers to get vaccinated to create a safer living and working environment for everyone. Compared to 12, 13 months ago, we're much better equipped now to deal with the health pandemic. Most importantly, employers and migrant workers have shown a significant amount of trust, patience, and support in the measures which we've had to implement. And one of the things we've learned is that we were able to bring the COVID-19 situation in the dorms under control because of the critical and crucial contributions of many, many volunteer workers who have helped workers overcome many of the fears and challenges that they face in Singapore, such as language barriers and the lack of social support. Many NGO volunteers have helped to distribute food and care packs to our migrant workers. Many migrant worker volunteers have also stepped up to disseminate information to their peers in native languages and work with MAM's FAST team, the Forward Assurance and Support team, to deliver assistance at the dormitories. Mr. Mutaya Diwakaran, a volunteer ambassador with the Migrant Workers Centre, MWC, has been in Singapore for about 20 years and currently resides at Cochrane Lodge 2. This is a purpose-built dorm. He reaches out to care for his peers, takes questions on the latest worksite and dorm measures, and encourages the workers to sign up for gov.sg WhatsApp updates in their preferred language. I would like to take this opportunity to sincerely thank all of you, volunteers, the various organizations, migrant workers, for bringing care, comfort, and company to our fellow migrant workers during this period. To better support and to better facilitate the outreach of more volunteer networks, ACE will partner key stakeholders to create a more structured ecosystem to engage workers. First, ACE will tap on existing volunteer networks, such as MWC's volunteer ambassadors, for a start, to set up a network of migrant worker volunteers in every dormitory with 100 or more residents. Through this network, ACE will partner dormitory operators, employers, and NGOs to better communicate with migrant workers, to understand their needs, and work collectively together to uplift their well-being. Second, we will also offer para-counseling training to our migrant worker volunteers to encourage peer support and better protect the mental health of our migrant workers. The initiative under Project Dawn helps workers to identify signs of stress and help them to perform simple breathing exercises that can help them relieve their anxiety and learn where to find and access mental health support in Singapore. Third, we will also support ground-up volunteer activities that can promote social cohesion amongst migrant communities. For International Migrants Day last year, we brought together 24 partner organizations and 180 volunteers to celebrate at 8 recreation centers all across Singapore. And we will do more to widen the circle of community volunteers. We hope that this new engagement model will encourage migrant workers to step forward and co-create solutions. We are always a work in progress, and we encourage everyone who has ideas to come forward and share with us so that we can work collectively to improve everyone's livelihoods. And we encourage employers to give your fullest support to migrant workers who wish to serve their dormitory residents. Ms. Hazel Phua and Mr. Pritam Singh asked about the enforcement of laws protecting migrant workers' employment rights, such as cases of underpayment of salary. In general, foreign employees in Singapore are protected under the same civil and criminal laws as citizens for general crimes, employment matters, safety and health, and injury claims. We provide foreign employees with additional protection under the Employment of Foreign Manpower Act, or EFMA, and the Employment Agencies Act, EAA. These prescribe the employer's responsibilities for hiring foreign employees, such as supervision and proper deployment, prompt payment of salaries, provision of a safe working environment, and ensuring acceptable accommodation. For the local employment agencies, we limit the fees in which they can charge workers. We will investigate all salary and fee-related complaints, which include underpayment of salaries, collection of kickbacks or recovering of employment costs, and excessive recruitment fees, and we will take necessary enforcement actions. Mr. Singh asked for the details of the number of migrant workers who are unpaid and the details of the restitution made. Between 2015 and 2019, 950 errant employers were caught for not paying the foreign employees their contractual fixed monthly salary or inflating the salaries with no intention of paying them the amount that has been declared. There were about 1,400 foreign employees affected in these cases. Penalties for the underpayment of salaries take into account the severity of the offence. For not paying the salaries that are due to them, employers could be prosecuted and they could be fined up to $10,000, jailed up to a year, or both, under the Employment of Foreign Manpower Act. These penalties were last reviewed and raised in 2012, up from a fine of up to $5,000 or jail of 6 months or both. So we've doubled it. Exploitation in any form is not fair to employees and is unacceptable. For underpayment of salaries, we will get the employers to make full restitution of salaries owed to the foreign employees. The vast majority have been able to recover their salaries in full. For willful employers, MOM will take further enforcement actions, and failure to comply will attract additional penalties, including payment of fines and serving an imprisonment sentence. Underpayment of salaries to any employee, foreign or local, is not tolerated, and we will not hesitate to take actions against any errant employers and parties who abet the offence. Mr. Singh, to your suggestion to require errant employers to pay the foreign employee a penalty amounting to 6 months of his salary for each instance of salary underpayment. MOM today already requires such employers to make full restitution of the salary owed to the employee and pay a fine or be jailed if prosecuted. We will facilitate the transfer of affected workers who want to continue to work in Singapore to a new employer. And in spite of many of these things that we've heard about, Singapore remains a very attractive destination for our migrant workers who want to come to work. So what we're trying to do is to assure workers that they can continue to stay in Singapore, because this is what they need, to earn an income when they report their employers for salary underpayment. So as such, at this particular point in time, we don't see the need to require the employer to pay the employee an amount beyond what was owed to him. One way to reduce the incidence of salary underpayment or non-payment is e-payment. As of January 2021, more than 97% of employers pay their migrant workers living in the dormitories electronically. For the remaining, we're in consultation with tripartite partners to extend requirements for electronic payments to more workers, including locals and work permit holders who are not living in the dorms. Mr. Louis Ng and Mr. Leon Pereira expressed concern, rightfully, about the recruitment process, including job advertisements, fees paid by migrant workers, and if it was possible to establish direct recruitment channels. Our laws limit the recruitment fees charged to migrant workers by the employment agencies in Singapore at 1 month of their salary for each year of their contract, capped at 2 months. So it's 1 month for each year, capped at 2 months. EAs must also refund 50% of the recruitment fee to the worker if the employment is terminated within 6 months. And Ministry of Manpower takes strong enforcement actions against EAs that do not comply with these requirements. MOM also actively takes enforcement action against persons performing EA activities without an EA license or engaging in hiring activities without an agent license. Such persons face a jail term of up to 2 years or a fine of up to $80,000 or both. Harsher penalties will be meted out for subsequent convictions, including fines of up to $160,000 or a jail term of up to 4 years or both. So receiving or offering payment as consideration for the employment of migrant workers is also prohibited under the EAA and the FMA Act. Offenders found guilty under the FMA Act can face a jail term of up to 2 years or a fine of up to $30,000 or both. In recent years, MOM has also adopted the use of data analytics to detect anomalies and fraud in the employment patterns of migrant workers more quickly and more accurately. And this has helped us to proactively detect cases in addition to complaints and tip-offs that when we receive from NGOs, MWC, ambassadors, and migrant workers. We encourage all parties to provide us with the different data sources so that we can triangulate better, and we encourage migrant workers who are made to pay monies to their employers or any other party as guarantee of employment, right? And members of the public with information to come forward on all these illegal recruitment and workplace practices and inform us immediately. This is our appeal to you. We have also ramped up education efforts. MOM has been educating foreign employees to report underpayment of salaries and employment kickbacks through various platforms and initiatives such as the FW MomCare app. During the mandatory settling in program and orientation for first-time work permit holders and roadshows, we will educate them. The regular presence of mums fast teams at the dorms also allows for early detection, and foreign workers, hence, they are now aware and they have multiple avenues to seek help. We continue to encourage, and we hope that you would help us to send a message out as well, that to ask them to come forward early to report if they face any employment-related issues. There was a decrease in illegal employment agent activities in 2019, with around 70 foreigners and 18 Singaporeans being taken to task, compared to an average of over 100 foreigners and 25 Singaporeans per year in the preceding 3 years. Now, we have not completely, we have not discounted this centralized job portal as suggested by members. While we see that as a possible opening and option, we recognize the fact that different employers tap on various channels to recruit employees, whether it's employment agencies, employee referrals, or direct hiring from source countries. If we want to mandate a centralized recruitment platform for all employers, many of our businesses have fed back that this will limit their hiring flexibilities to meet their respective manpower needs. So I think we have to be open to all different options. So in addition, such a platform can reduce, but they do not necessarily completely eliminate fees paid by migrant workers to these unlicensed overseas agents or middlemen to assist with the documentation that's required, or to help them link them to this platform, or licensed, so to speak, employment agencies in the source countries. So this is always a lot of hard work in progress. We will constantly and continually work with stakeholders, including employers, migrant workers themselves, the NGOs, the employment agencies, to explore the various suggestions that have been brought up in the past as well as today and moving forward, right? To reduce the recruitment costs incurred by migrant workers seeking a job in Singapore. And like my appeal earlier on, the support of employers, the NGOs, acceptance by workers will be crucial. Ms. Rachel Ong asked about protecting the rights of workers to safe and hygienic meals. Today, there are various options, including self-cooked food. Migrant workers who face issues with access to adequate and proper food or other well-being concerns should report their cases to us at MOM. MOM will address the issues with the employers. And in serious cases, we will take appropriate enforcement action. And we are happy to work with NGOs, with dorm operators, and employers to explore different ways to ensure that our workers receive sufficient, sustainable, and nutritious food. With the outbreak in the dorms now under control, many volunteers are concerned about the strict measures that remain in place for workers residing in dormitories, even as the country moves into phase 3. We understand and we empathize with the needs and the needs for social interaction. At the same time, we are also concerned about the livelihoods of workers should a second wave or clusters develop in dormitories. We are therefore calibrating and easing restrictions in a very carefully controlled, in a safe manner, particularly given the fact that there's a lot of news about more virulent strains emerging. Communal facilities have resumed operations in dormitories where operators have demonstrated good compliance with safe management measures. Starting from this month, instead of once a week, that means in early March, instead of once a week, migrant workers can visit recreational centers up to 3 times a week on their rest days or after working hours. And each visit will be extended from the current 3 to 4 hours. Workers will have more time to carry out their personal errands or to do some sports. And to mitigate transmission risks from intermixing, these workers must have attended their rostered routine testing, and they must continue to carry their contact tracing devices. We are also currently drawing up plans to allow eligible workers to visit the community once a month. The operational details are being worked out to keep the numbers in the community manageable. We have no intention whatsoever for restrictions to be stricter than necessary or to be in place longer than what is necessary, because we are dealing with the real risks posed by COVID-19, especially when we are trying to prevent cross-transmission or possible reinfection. Hence, we appeal to all of you for your support, for your understanding, as we continue to calibrate measures to adapt to the ever-evolving situations. And we are just doing our level best to make efforts to restore the sense of normalcy where it's possible. Mr. Chairman, in Chinese, 在过去的1年，新加坡采取了一系列对抗关闭疫情的措施。我们从中获取了宝贵的知识和经验，也能更好地为下一个疫情做好准备和防备。接下来，人力部将三管齐下，进一步提升客工和客工宿舍的防疫应对的能力。首先，我们必须继续巩固对抗冠病疫情的第一道防线。我们要在客工抵境之前以及抵境之际做好防范措施。我们将推行客工入职报到中心试点计划，更好地统筹以协调建筑、海事和加工业的工作准证和 S 准证持有者必须履行居家的通知，以及接受抵境检测等的安全程序。在紧急情况之下，我们也既能及时地调整客工抵境前和入境后的措施，将新来客工可能在工作场所、宿舍和社区传播病毒的风险，把它减到最低。第二，我们将提高客工宿舍的防疫管理。外籍雇员宿舍法令将扩大，逐步涵盖全国所有的客工宿舍，包括少于1000个床位的小型宿舍。这将有助于我们不断地提高各类型客工宿舍的标准，并通过执法让业者严格地遵守。第三，我们将建立强大的资源系统，确保我们在各方面所做的努力可以持续。这包括为居住在宿舍或社区的客工提供更好的医疗保健和社交网络。对抗疫情，人人有责。只有在雇主、宿舍业者、客工、社区团体等多方面的紧密协调和配合之下，我们才能降低冠病疫情爆发的风险。我们 更会有信心的迎接跟迈向一个新的常态。In conclusion, Mr. Chairman, our efforts to build a safe and resilient migrant workforce must not stop here. In fact, we are just beginning. We will fortify our defenses through upstream measures before and when workers arrive into Singapore. This series of safeguards will help us to better manage any risk of imported cases and to better onboard them. We will raise the living standards and enhance all of our processes in our dormitories to strengthen our collective ability to respond effectively and rapidly to future outbreaks. We will put in place strong support systems to make these efforts sustainable over the longer term, including strengthening healthcare provision and social networks for workers residing in the different dormitory and the different housing types. We recognize that these efforts come at a cost, but prevention is always better than cure. The government believes that investing in these preventive measures today will save us from spending more in the future to manage future outbreaks. On this note, I appeal and I urge everyone, and employers in particular, to seize this opportunity to accelerate your adoption of higher productivity and less labor-intensive industry models. We call upon all of you over the last 1 year who have braved the storm together with us. You have expended significant resources, significant opportunity costs. We should all collectively take active steps. We should all collectively strengthen our workforce, our workplace resilience, and to put in place robust and sustainable measures that will see us through the long haul. Future pandemics is not a question of if, it's a question of when. Together, if we put our hearts, our minds together, we will always be ready for future pandemics. Thank you.